Welcome to Nurse's Handbook. Today I have brought to you some multiple choice questions for the upcoming Norcet 2023. Question number 1. All of the following are types of conflict except option A, intrapersonal, option B, manifest, option C, interpersonal, and option D, intragroup. And the correct answer is option B, manifest. So let us see what is conflict. Conflict is a state of opposition, disagreement, or incapability within self, between two or more people, or a group of people. Now, let us see the types of conflicts. The first type is the intrapersonal conflict. When the conflict is within self or with self, then it is known as the intrapersonal conflict. Then comes the interpersonal conflict. When the conflict is between two people or two persons, we call it as interpersonal conflict. Then comes our organizational conflict, which is also known as the group conflict. It is further divided into inter-organizational and intra-organizational. Inter-organizational conflict means the conflict which is between two different organizations or between two group of people, whereas intra-organization is within the organization or within the group. If the people are having conflict with each other, we call it as the intra-organizational conflict. Manifest is not a type of conflict, but it is one of the 5 stages of conflict. Now let us see the 5 stages of conflict. The first stage is the latent stage. Here, the people who are in conflict, they are not aware that they are in conflict. The second stage is the perceived stage, where both the people or the single person, whoever is experiencing conflict, is aware that he or she is in a state of conflict. Then comes the felt stage. In this, the people involved in the conflict will feel some stress and anxiety because of the existing conflict. Then comes the manifest stage. This is an observed stage where the other people can see the conflict between the two people. Last is the aftermath stage. In this, some outcome of the conflict will be coming. Moving to the next question, that is magical thinking is mainly seen in option A, preschoolers, option B, infants, option C, toddlers, and option D, adolescents. And the correct answer is option A, preschoolers. So what is basically a magical thinking? It is a belief that one's own thoughts, wishes, or desires can influence the external world. It is mostly seen in the age group of 3 to 5 years, that is in our preschoolers. At this developmental stage, children believe in fantasy and even try out playing those characters which is in their fantasy. For an example here, a 4-year-old child might believe that after wishing for a unicorn, one will appear at his or her house. Question number 3. Which of the following drugs requires a CBC blood test on a regular basis? Option A, lithium. Option B, alprazolam. Option C, clozapine. Option D, haloperidol. And the correct answer is option C, clozapine. Clozapine belongs to the class of atypical or second generation antipsychotic drug. It is mainly used for the treatment of resistant schizophrenia and in cases to decrease suicide risk in schizophrenic patients. So, regular monitoring of WBC and neutrophil count has to be done, as clozapine may cause neutropenia and agranulocytosis in the patient. Moving to the fourth question. What are some of the anticholinergic side effects of TCA therapy? Option A, tremors and cardiac arrhythmias. Option B, sleeplessness. Option C, urine retention and blurred vision. And option D, Kussmaul breathing. And the correct answer is option C, urine retention and blurred vision. TCA, that is tricyclic antidepressants, belongs to the class of antidepressants. This drug increases the level of norepinephrine and serotonin, and on the other hand, it blocks the action of acetylcholine. And because of that, the anticholinergic effects can be seen in patients who are consuming the TCA. So what are the common anticholinergic effects which are seen? That is dry mouth, blurred vision, constipation, urinary retention, drowsiness, orthostatic hypotension, etc. Question number 5. What is the important nursing action while administering imipramine? Option A. Avoid administration of barbiturates or steroids with this drug. Option B. Warn the client not to eat cheese, fermenting products and chicken liver. Option C. Have the client check the intraocular pressure and provide instruction to be alert for symptoms of glaucoma. Option D. Observe the client for increased tolerance so that dosage is maintained. And the correct answer is option C. Have the client check the intraocular pressure and provide instruction to be alert for symptoms of glaucoma. Imipramine belongs to the class of tricyclic group of antidepressants. Development of glaucoma is one of the most common side effects of imipramine. So option B is applicable to MAOI group of antidepressants, not for imipramine. Question number 6. Disulfiram therapy is dash type of aversion therapy. Option A. Covert sensitization. Option B. Desensitization. Option C. Overt sensitization. And option D. Flooding. And the correct answer is option C. Overt sensitization. So let us see what is an aversion therapy. In this treatment method, a person is conditioned to dislike a certain stimulus due to its repeated pairing with an unpleasant stimulus. For an example, if a person is having a bad habit of alcohol or smoking, then we give some stimulus, unpleasant stimulus to this drinking or smoking habit, which will slowly help the patient to slow down or to leave the alcoholism or smoking. Aversion therapy is mainly of two types, that is overt sensitization and covert sensitization. In overt sensitization, we link an unpleasant stimuli such as nausea to an undesirable behavior. So nausea is the unpleasant stimuli and undesirable behavior can be alcoholism, smoking, etc. So here we have an example that disulfiram is given to alcoholics, which causes painful effects of a hangover if the client drinks an alcoholic beverage while taking disulfiram. Right? Now moving to the second type of aversion therapy, that is covert sensitization. In this, clients are taught to associate an imagined negative stimulus with the behavior that they wish to eliminate or reduce. Here, there is no unpleasant stimuli, but we just ask the patient to think and imagine an unpleasant situation or stimuli with the behavior they want to eliminate or reduce. Moving to question number 7. In which condition does the children pull out their hair? Option A. Autism. Option B. Trichotillomania. Option C. Attention deficit hyperactivity disorder. And option D. Tic disorder. And the correct answer is option B. Trichotillomania. So trichotillomania is also known as the hair pulling disorder. It is a mental disorder. In this, recurrent irresistible urges will be there to pull out hair from your body part. Despite trying to stop, the person will be pulling out the hair. Question number 8. The power that represents the sexual instinct in the mind is known as A. Libido. Option B. Positions. Option C. Condensations. And option D. Fetishism. And the correct answer is option A. Libido. So it is the instinct in the mind which presents the sexual desire. Question number 9. A nurse is forming a care plan for a female client suffering from anorexia nervosa. Which of the following actions should the nurse include in her plan? Option A. Restrict the visitors. Option B. Providing privacy during meals. Option C. Encourage client to exercise to reduce anxiety. And option D. Set up a strict eating plan for the client. And the correct answer is option D. Setting up a strict eating plan for the patients of anorexia nervosa. Why? Establishing a good eating plan and monitoring the client's weight are important in developing a care for the anorexia nervosa patient. Including the family members in the plan of care is important as it will help the family members to care for the patient adequately. Secondly, client should be monitored during meals. So client privacy is not necessary, but only monitoring is necessary. Only limited and supervised exercise is recommended for the patients with anorexia nervosa. Moving to question number 10. Which nursing treatments are most effective in meeting the needs of people who have OCD? Option 1. Supporting but limiting their behavior. Option B. Restricting their movements. Option C. Calling attention to their behavior. And option D. Keeping them busy to distract them. And the correct answer is option A. Supporting but limiting their behavior. Accepting the client and their symptomatic behavior will help to develop a good nurse-patient relationship. Setting limit provides external control and it will help to lower the anxiety in such patient. Calling attention to the behavior will increase the anxiety in OCD patients. Lastly, distraction is an unrealistic goal, especially in OCD patients.